Good morning to you. I'm Allison Seymour. We're interrupting Wendy right now to bring you the almost daily conference with Mayor Bowser talking about the state of affairs amid the coronavirus pandemic in the nation's capital.
Yeah, a couple of different things she's always talking about is where things stand with those numbers, Allison, how she's handling the schools, how she's telling people to stay at home, the unemployment rates, all kinds of things like that. So just let's listen to the mayor right now.
I'm the mayor of Washington, D.C., and this morning I'm going to share the latest on the district's response to COVID-19. We will provide an update on our medical surge planning and provide more information on our Reopen DC Advisory Committee. This morning, we reported an additional 51 cases of COVID-19 positive tests in the district, bringing our positives to 3,892. And we also reported this morning that 185 DC residents have succumbed to this virus. I wanted to also show you what our curves look like in terms of positive cases, and also show you the several days worth of case totals. One of our criteria for reopening is, of course, to meet 14 days of sustained declines in cases. And you can see we are not there yet. We have not begun to see a period of declines. So it continues to be critical that DC residents stay at home and practice social distancing. We also continue to spread the word about how important it is for DC residents who are having symptoms or who are in a priority group and been exposed in some way to COVID-19. We talked previously about how we are focusing on vulnerable populations in Washington, D.C., and one way to reach out to vulnerable populations was by working with those residents who participate in our Medicaid program. And starting last Friday, we also began doing ward-specific calls with council members to help us get the word out about testing. Last Friday, council members Gray and White sent out a call to constituents in Ward 7 and 8 with the citywide call-in number. And today, council members Todd and McDuffie from Ward 4 and Ward 5 will send out a similar call asking people to, if they have symptoms, if they're in those priority groups and have been exposed, to call to be tested. Again, we have focused on all of the citywide opportunities with private providers and public providers, and we're asking everybody to reach out to their provider or the citywide call-in line if they fall into those groups or areas of concern. The citywide call number, once again, is 855-363-0333. So we're asking everybody to pay close attention to how they're feeling. And starting this week, also former First Lady Michelle Obama is going to help us get the word out as well about symptoms and testing through robocalls and radio ads. I believe we can share with you a message that she will be sending. Additionally, some DC residents will receive a mailing from us that outlines the locations and phone numbers that they can call if they're experiencing symptoms or have been exposed to the virus in some way. So we're going to share that, but I just want to say that early on in our response, the First Lady's office reached out to us to ask how she could help, and I'm going to play the radio ad. Let's just pause that for a second because I can't hear it. Okay. So you'll see we're going to get that out far and wide in calls, I think radio, and we're examining how we can get that word out on social media as well. So thank you, former First Lady Obama. And with that, let me turn to our medical surge update. In total, you've heard us talk about before, we have projected needing up to 3,600 additional beds across our system, and about 1,600 of those beds will be in area hospitals, and we can accommodate up to 2,000, nearly 2,000 beds at the DC Convention Center. Already, our hospitals have added 1,000 beds, and the additional 600 beds will be ready by May 1st, and by May 8th, we will have 500 beds up at the Convention Center, and we'll phase the construction of the additional Convention Center beds along the way. Our emergency operations team is also working with hospitals to secure other contracts to make sure that we have the staff, PPE, and equipment necessary to operate these additional medical surge beds. We're also sharing here our estimates for the additional, some are thinking around the additional supplies that will be needed, in addition to this, very importantly, the staff that will be needed to staff those additional beds. To support these efforts through the Department of Healthcare Finance, we are awarding $25 million in grants to 10 hospitals. Each hospital is receiving an award on how many additional beds they are contributing to the surge. These grants were, of course, recently passed in the Council's second COVID-19 Response Supplemental Emergency Act of 2020 and can be used for supplies, equipment, personnel, the construction and operation of temporary structures for testing and treatment. Finally, I want to share some updates on Reopen DC advisory group that I announced here last week. As I shared on Thursday, Reopen DC is about working together as a community to reopen our city in a way that is safe and sustainable. We are, of course, all eager to open our schools, our businesses, and be able to get back together with family and friends. But we are all focused on how we do it safely, and we need a plan ready to go that is based on the science and tailored to the needs of our community. The Reopen DC Advisory Group will help us put that together. Today, I'm proud to share that this advisory group is being chaired by two outstanding Washingtonians who have served several U.S. presidents, including positions in the Clinton, Bush, and Obama administrations. Former U.S. National Security Advisor Susan Rice and former Secretary of the U.S. Department of Homeland Security Michael Chertoff. So I want to thank them for bringing their vast experience to this effort and their willingness to serve their city. Along with 6 co-chairs, they will lead the Reopen DC Steering Committee, which will provide leadership to the sector committees to help evaluate community feedback, synthesize expert health and medical feedback, evaluate national and global best practices, and make sector-specific recommendations to me regarding plans for reopening. The 6 co-chairs that will serve on the steering committee are former Mayor Anthony Williams, former Mayor Adrian Fenty, Council Chairman Phil Mendelson, Chief Financial Officer Jeffrey DeWitt, former Assistant Secretary for Preparedness and Response at the U.S. Department of Health and Human Services, Nicole Laurie, and my senior advisor, Beverly Perry. Our chairs and co-chairs come to this project with a broad set of skills, experience, and knowledge. They all know and understand the district and are eager to get feedback from residents and local businesses. The group has a big task, and they have a relatively short time to work on it, and they are all up to it and ready to help the district respond. Here are a couple of important dates that we want to share regarding the advisory committee. This Wednesday, on April 29th, the advisory committee will be hosting a virtual town hall, and this is an opportunity to share updates with and get feedback from DC residents. And more information on the town hall will be posted at coronavirus.dc.gov. And then I expect during the week of May 11th, the advisory group will submit an initial report to me, and this report will have a high-level guidance around reopening, as well as some sector-specific guidance. This is a relatively quick process, but it's also one that is very focused on gathering as much expert advice and community feedback as we can. So I invite DC residents to check out coronavirus.dc.gov/reopendc. Tomorrow, there will be a survey to take, and you may join us Wednesday for a virtual town hall. And Andrew Trueblood, who is the director of the DC Office of Planning, will staff the steering committee. We're supported by a number of DC government folks who will help staff those subcommittees as well. And Dr. LaQuandra Nesbitt will be the health advisor to the steering committee, and members of her team will also serve in the health advisory capacity to the sector committees. So with that, we will answer some questions. Any questions? Yes, Sam?
Yes, Mayor. Last week I asked you about the DC jail, and of course, I guess the weekend before last was a court order. Could you give us some report as to how the situation is at the jail? Last week we were saying that in some cases people said the inmates were being locked up for extended periods. I'd like to know what's the situation there. Has the city got a cleaning contractor over there? Have they named some sanitarian as mentioned in the court order?
As I mentioned, we have a team that is looking through all of the recommendations of the court, in addition to all of the things that we were already doing and continuing to make sure that those processes are not only happening, but that they're verifiable. And that we're bringing all new best practices around congregate care settings to the process as we can. So that is ongoing. Our commitment to making sure that our staff at DC Jail and the inmates at DC Jail are getting the very best in care given the unprecedented circumstances that we're all living through.
Also, Mayor, there is a halfway house in Ward 8, and I understand that the Bureau of Prisons is sending most of those people home, and in some cases, some of them are being transferred. Obviously, that has been a concern of the city. Do you have any comment on that?
I think you're referring to Hope Village, and Hope Village is a group home for people, a halfway house And it houses, I think, over 200 people. The contractor with the Federal Bureau of Prisons indicated that they no longer wanted the contract. The Federal Bureau of Prisons is trying to make sure that every person there has the appropriate placement. In some cases, the people are eligible for release and they have a safe release plan, and I understand that they will be released. And others are not and do not have a safe release plan, and they will be relocated to other facilities supported by the Bureau of Prisons. Our ask is that they be located in the district or as close to the district as possible. Yes.
You and Governors Hogan and Northam have been in lockstep with the closings and your reaction or response to COVID-19. I was wondering how that will apply to reopening.
All right, you're listening to Washington, D.C. Mayor Muriel Bowser giving an update on the coronavirus situation here in Washington, D.C. A couple of things to point out here. She talked about 51 new positive tests to bring the total to 3,892 and 185 deaths. And also want to talk about this because she talked about this on Friday about this Reopen D.C. Advisory Committee that will be chaired by two people who have previously worked with some other presidents, as in Susan Rice and Michael Chertoff. Those are going to be the chairs of that committee. There's a meeting Wednesday, April 29th, where that committee will hold a virtual town hall where residents can call in and get information about what the city is doing. And also that same committee will submit a reopening proposal to the mayor on May 11th. It is basically the guidance for how they can get things reopened depending on where they are by May 11th. Allison.
Mm-hmm. And what I found really interesting, people who definitely are intimately familiar with the District of Columbia and how it works, two former mayors on that steering committee, Mayor Williams and Mayor Fenty, also bringing in some federal help with former First Lady Michelle Obama. She'll soon be the voice of some just reminders, and also some reminders of free testing sites throughout the city. So looking forward to that on the radio, and then also robocalls. Don't be surprised when Michelle Obama is on the other end of the line, Wiz.
Yeah, you're right. And then the other thing is they talked about this situation with the hospital beds, just in case they're needed. But they're already, she always talks about having a plan in place. So they need up to 3,600 additional beds, 1,600 at area hospitals, additional 600 by May 1st. They're going to set up something at the convention center to deal with patients just in case they need that. They're also making sure that they have the appropriate number of staff and PPEs as well. And she also mentioned that these hospitals in Washington, D.C. are getting grants from the government that they can use for a variety of different things to help in the fight against the coronavirus. Things like supplies, staff, if they have to build something, any kind of personnel, any kind of treatment. They just want to make sure that in the event that this curve does not flatten enough, that they will be ready in the event that this coronavirus is not seeing a downward trend that they would like to see.
Absolutely. You always wait for that glimmer of hope, though optimistic. She did say we're not there yet. All right. Well, with that, I believe that we're signing off from the mayor's press conference for today, and we will return you now to your regularly scheduled programming, which is Wendy Williams.
Have a good day.